I want to welcome everybody and good afternoon. I'm Jill Kagan with the Arch National Respite Network and Resource Center, and thank you all so much for joining today's Volunteer Learning Collaborative call. Um, I just mentioned about muting and unmuting yourself. Again, these voucher collaborative calls are a little bit more informal than our regular webinars, so we would love it if you were able to participate fully. We do have two presenters today. Who will be making short presentations about their respective voucher programs. And then after they're done, we'll open up the call to questions and discussion. But in the meantime, if you like, you can type questions into the chat box at any time as well, if you don't want to ask it out loud. But we will wait to respond to questions until after our presenters have finished. We are recording the webinar and we'll make that available in the next few days, and we'll notify everyone by email when it is available. I will also upload the PowerPoint slides into the chat box in a few minutes once we get started, and you can download the slides from there. I'll also send them around when I send around the call recording. Why don't we start off by just finding out who is on the call today? And I thought we might start with our learning collaborative leaders if they're with us. Linda Porter, I'm not sure who is the founder of this group. I'm not sure she's with us today. If you are, Linda, if you'd like to say hello. I don't see her name on the list. Catherine Sims from Colorado, are you with us? And if you have
I'm here.
If you have anything you want to share about what you hope the group will get out of the call today, that would be great.
Yeah, sure. So I'm Catherine Sims. I am the program coordinator of the voucher program at Colorado Respite Coalition. I'm fairly new. I came on in November, so I think the biggest thing for me in this talk and further talks is really understanding how everyone navigates their voucher programs in different ways, and also tips and tricks for actively tying together community providers and families and covering those hard gaps that I know we all face. So I think that's my biggest stake in these conversations, and I think it's invaluable to continuously share information and questions with each other.
Great, thank you, Catherine. Nadine, are you with us?
Jill, no, she is not. She may be joining late. She had a conflict.
Okay, I just wanted to acknowledge her as one of our learning collaborative leaders. Why don't we go around then on the phone and see who else is on the call? Just pop yourself in and unmute yourself and tell us your name and what state you're from.
Hi, Jill. This is Leanne Winchester from Massachusetts.
Hi, Leanne.
Hi, Jill. This is Jamie Ahumada and
Autumn Blattman
from Nevada.
Brooke Bartholomew and Vicki Clear from Montana.
This is Lori Stahlbaum from ACL.
Hey, Lori.
Hi, Jill.
This is Cheryl Donnell. I'm also from Nevada.
This is Corey Lutz from Nevada.
Patrick Kelly, Carrie Rattleback from Montana.
Great, welcome.
And this is
Carmel
Yuta from
North Dakota.
I'm sorry, who was that?
Carmel Frumke from North Dakota.
Hi, how are you? Great.
And this is Yuta Ulrich from Arizona.
Anybody else?
Christine Santee, Delaware.
Excellent. Did we miss anybody? Okay, great. I just have a couple of quick announcements. We were talking about this before we went live, but we have been getting quite a few questions about cancellation plans for the International Respite Conference. and the Lifespan Respite Learning Symposium in Madison. And I just want to let you know that as of today, we are still planning on hosting the event, but the planning committee is meeting regularly to review the most recent CDC and WHO guidelines. We've been trying to listen to the experts, and we're very hopeful that the pandemic will dissipate by mid-May, but of course that's not guaranteed. So I hope all of you will be able to bear with us. From my own personal experience, I know that fortunately most major airlines are waiving their change fees, so hopefully that won't be a burden to anyone. If the International Short Break Association decides to cancel the conference entirely rather than postpone it, ARCH will still make every effort to proceed in midsummer or early fall with the grantee meeting, the Learning Symposium, and the Respite Research Summit. So all I can ask is your patience and to bear with us, and we'll try to alert you of any cancellations with as much advance notice as possible. Are there any questions about the conference or the Learning Symposium at this point? Oh, and I see Dina and Abby from New York have also joined us. Welcome. And Jill from Washington, and Joe Ward from South Carolina. Welcome to all of you. I also just wanted to briefly mention, and I sent around an email a few weeks ago about this, that ACL recently issued forecasts for posting of the new Lifespan Respite Program funding opportunities. And I just wanted to make sure that you all knew that this was coming up. ACL estimates that the funding opportunity announcement for grants to new states will be posted on March 16th. That's this coming Monday. And the estimated post date for the funding opportunity for state program enhancement grants, that's for most current or former grantees, is March 20th. So be sure to check grants.gov next week for those postings, and ARCH will do our best to send out reminders about that as well once they've been posted.
Jill?
Lori, I don't know if you want to add anything, Lori?
I just wanted to add, thank you for sharing that. And people are not aware, if you go to grants.gov, you can set up to get a notification when the actual funding opportunity announcement posts. Also, our communications office, if you're on our delivery, email blast delivery system, it seems, I can't say I'm 100% certain, but they have been working very hard to make sure that every funding opportunity announcement that gets published is sent out through the email blast to like 20,000 people. So if you're one of the 20,000, there are ways. But the grants.gov reminder system is very helpful. If anyone's interested.
Great. Thank you for reminding us about that, Lori. That's very helpful.
You're welcome. Bye. Muting.
Okay, for those of you who are new to our Voucher Learning Collaborative, welcome, and we're always welcoming anyone who wants to join us. Just a little bit of history. The collaborative did begin back in May 2018 at the request of two of our coalition grantees who wanted to have a forum for talking with their colleagues around the country about challenges and successes in implementing voucher respite programs. And these two folks stepped forward and assumed the role of leaders in the collaborative. One of these collaborative leaders, Linda Porter with Lifespan Respite Washington, unfortunately for us, just informed me this week that she is leaving. And I just want to acknowledge her leadership in the collaborative and how much she contributed to getting the group off the ground. And we're really going to miss her very much. Others who joined her in this leadership role now are Nadine Walter of Oklahoma, and as we heard, she'll hopefully be joining us later. And Catherine Sims from Colorado introduced herself earlier and let us all know what she's hoping to get out of the group as well. We will make every attempt to continue to have the group meet quarterly if schedules permit. If you have a special topic related to voucher implementation that you'd like to focus on, this is your group. So please let me or one of the collaborative leaders know, and we'll make sure to target the next voucher call around that topic. Any questions about the collaborative? You can see from the slide that's up there now, if you want to go back and listen to past calls or look at the resources that states have shared, that's the link for the Voucher Learning Collaborative posted on that slide. I also have up there, one of the first activities that the collaborative did was to undertake a survey of the members of the collaborative and other state lifespan grantees that we knew of that were running voucher programs, and in conjunction with Nadine in Oklahoma and Sooner Success, they helped us pull together a wonderful survey to get a good baseline data of all the details of voucher implementation in about 15 states. So if you haven't had a chance to look at those survey results, feel free to do so at that link. Great. I'm really excited to have two presenters today from among our network of lifespan respite grantees and partners. Both were kind enough to agree to share the details about their voucher program implementation. And as always, we have a lot to learn from different ways of doing voucher delivery. And hopefully these approaches will help inform the work that all of you are doing or considering doing. And as I said earlier, once they've made their presentations, we'll open the call to questions. And we really would love to hear from each of you about your own voucher program and how it's similar or how it might differ from these programs examples. And again, if some of you are just thinking about starting a respite voucher program and have questions, this is the time to take advantage of having all these experts on the call and to ask your questions. I'll go ahead and introduce our first presenter is Robin Boswell, Special Programs Coordinator with Sooner Success in Oklahoma City. And Robin oversees the Respite Voucher Program. Sooner Success partners with the Oklahoma Department of Human Services to implement the Lifespan Respite Grant. Our second speaker is Rachel Hatton, the Executive Director of the South Carolina Respite Coalition. The coalition also works closely with the South Carolina Department of Aging to implement their Lifespan Respite Grant. So thanks again to both of you for agreeing to present today and kick off our discussion. And we're very grateful again. I want to just thank you one more time for your willingness to share this information. And Robin, I'll go ahead and turn it over to you.
Great. Thank you so much.
Just let me know when you want me to advance your slides.
Okay, sure. I'm feel very fortunate to have the opportunity to share about our respite voucher program in Oklahoma. And I have my executive director of Sooner Success, Aida Stevens, with me, and I was going to let her kind of kick it off, and then I'll slide in.
Great. Good afternoon, everyone. I share that enthusiasm with Robin. We're looking forward to some good discussion and just sharing what we've been doing in partnership with our Oklahoma Aging Services, Nadine Walter, who also serves on the collaborative. So next slide. Jill, okay. So here in Oklahoma, we really have focused on to expand, enhance, ensure the sustainability of gap-filling respite services to our Oklahoma family caregivers across the lifespan and disability spectrum. Next. And really, it's been in partnership with the Administration for Community Living, Oklahoma Human Services, Aging Services, and our program, Sooner Success. We're actually, we've been established over 18 years here at the University of Oklahoma Health Sciences Center. We're in the Department of Developmental Behavioral Pediatrics. And we've been fortunate to be able to work with the Administration for Community Living since 2010, and in partnership with Aging Services to reach caregivers across the lifespan. Next slide. So what's exciting is we not only have aging services, but we have over 170 partners that participate on our Oklahoma Caregiver Coalition. This coalition is very active, specifically our subcommittee Respite. And although I won't read this slide verbatim, what is great is the partners that have other statewide respite programs actively coordinate so that caregivers can access respite. And of course, that's priority number one for our Oklahoma Caregiver Coalition. We do have other subcommittees. Back in 2016, we did a survey needs assessment. We surveyed not only caregivers, but we surveyed the providers that serve them. And from that needs assessment, it did help establish the other subcommittees. So as you see, some top needs that you working with caregivers may identify with, we have transportation, home safety modification, health, advancement, legal, financial, advocacy, and psychosocial support. So those are our parent support groups, caregiver support groups, and behavioral health needs that our caregivers have. So again, this coalition is active. We meet quarterly. And what's so important to emphasize, these are providers and partners that serve, again, those that have a child with special health care needs and across the lifespan to our older caregivers. And so we're fortunate, again, here to be able to serve caregivers up to age 59 under our lifespan program. And when we talk about filling the gap, that subcommittee on respite, those partners are in contact weekly as they get calls that perhaps don't qualify under their program. That's where our lifespan respite voucher program comes in. Next slide. So for our purposes, the caregiver really is probably no surprise. Jill, if you'll just click it again and let's see the other categories. It's very broad. So if they are a caregiver that has a loved one, we want to serve them. And so again, you may be working with more grandparents raising grandchildren. I know we have a high rate in Oklahoma. And so more and more we're seeing grandparents raising grandchildren, and we want to connect them to respite. Next slide. Okay, so now we're going to go into the specifics, and that's where I'll hand it over to Robin, and she can go into those details.
We use the terminology caregiver for the caregiver that is the full-time unpaid caregiver for a loved one with a chronic health condition or disability. All our caregivers must be 18 or older. We also serve grandparents or other relatives raising a child as the full-time parent, age 54 and younger. We have a household income threshold of $90,000, and we have to make sure that they're not receiving respite from other programs, and including like a foster care payment, the family support assistance payment, the OAA Title III-E, or the Oklahoma Department of Mental Health Systems of Care funding, which they do have a respite voucher program, or they're not receiving the DHS child care subsidy. Next slide. Then we call the individual that needs care receiver. And I know other entities may use a different term, but we use care receiver. Birth to 59, they need assistance with activities of daily living in order to stay at home in the community, and they must have a social security number. It can be a neurological diagnosis, a TBI, MS, muscular dystrophy. Also, it could be autism, developmental intellectual disability. It's very broad. They cannot be receiving payments through other programs such as through DDS services, the SSI Disabled Children's Program, Advantage Waiver, or Medicare funded home health services or hospice. Next slide. Then we have the respite provider, and that's we allow the caregiver to choose the person or entity that they would like to use as their respite provider. We have found that most use a family member, second would be a friend, and but we also allow our caregivers to choose a center-based program such as an adult day program. It could be a daycare center, a therapeutic riding program, a camp, whatever the caregiver chooses, and as long as we can work out with that respite provider to take the voucher, that's up to the caregiver. The respite provider must be over 18, have a Social Security card, and live outside the home of the caregiver and the care receiver. We pay all respite after the care has been provided. We mail the check directly to the respite provider. The amount paid per hour is up to the caregiver, and we also give them the option, the caregiver has the option to use, they can get up to 3 vouchers in the 90 days, and they can choose to use all the $300 at one time, or to space it out over 3 months. Next slide. And so eligible caregivers can receive $300 worth of respite vouchers. They have 3 months to use it. They can keep reapplying every 3 months. Most of, or really all the caregivers initially go through me. I do a basic screening. We have a very short application. The front is about the caregiver, the back is about the care receiver, and we take that initial application, and based on that, they're approved or not, or I refer them to another respite voucher program if there is a better fit for them. We need to stretch our dollars, and so when there are other programs in the state, I always try to refer to other programs if that's more appropriate. They also complete a pre-voucher survey before they receive their vouchers. Most of the time that is sent out with the application. Then we send a cover letter explaining the use of the voucher, even though I've usually visited with them on the phone about that. And I provide pre-addressed, pre-stamped envelopes for them to return the survey and return the vouchers and the application if I mail it, but I also can email. Next. That's a copy of our application, and it is front and back. It's all self-reporting, and we just have to make sure that everything's completed as much as possible and that they fit our program. Next. And then we do data collection. We collect pre-voucher surveys. We also do post-voucher surveys. They are also completed by the caregiver. Our goal is to get them out within 1 month after they've received respite. So usually when I get a set of vouchers back and they're getting ready for another set, I can send that out sooner if possible, but we try to make sure we have a better collection rate on pre-voucher surveys than post-vouchers, but I'm constantly sending out and following up on post-vouchers. The data on each caregiver is monitored. We make sure that if they exceed the $300, that they understand they're responsible for that. And we are reporting, and we are analyzing and reporting the data. Next. So just some of the survey responses. Most of the time, the respite was used for shopping or errands by the caregiver, spending time with spouse, and also leisure time. The care receiver benefited mostly by having interaction with others And remember, the care receiver is the birth to 59 individual that needs the care. 92% of caregivers indicated that participation lowered their overall stress level. 81% would not be able to have respite if this program was not available. 40% do not have other family members involved in the caregiving, and 100% were satisfied with the program. Next. We also, in order to serve caregivers as much as we can, not everyone wants the typical voucher, or they're on another voucher program. We can offer educational vouchers as part of this grant. If a caregiver is attending an educational event or conference and they have to hire someone to watch their care receiver, then for full day attendance at the conference, we are able to issue a $100 voucher. If they are only there half a day, then we can offer a $50 half day voucher. They can be receiving other vouchers in order to receive the educational voucher. This is a different component to our program. Also, there's emergency vouchers. If you have a caregiver that is needing to have surgery, or they have to travel out of state to a funeral, or it's an unexpected, unplanned event, they could be eligible for a one-time $250 voucher to help with that crunch time. The third is community grants, and we have issued 16 community grants, and it is a minimum program of 3 hours. It's for caregivers and care receivers of all kinds. They can apply for 500 or more based on their respite program, and we're serving through the community grants. We're accessing rural communities, and we are trying to reach caregivers and care receivers of all ages and all types of caregivers, and so that's been a good thing.
And just to interject, that's really helping us build capacity across the state, getting more community partners engaged in increasing access for respite. It's been great. These are partners that perhaps have an adult day program, or these are our faith-based partners. These are childcare providers. So it's been very interesting to see this develop and build capacity across our state. Next slide. We thought it would be fun just to share some of the photos. The next couple of slides, Jill, if you just want to go through those. Those are just some good photos of our respite and SIB shops programs. The next slide, we go into more detail about supporting siblings. We strive to have a comprehensive approach, and so often siblings are, their needs are unmet. So what's great about SIB shops, it's a research-based program. Hopefully those on the call have heard of SIB shops. If you haven't, please do look it up. There's over 30 years of research that has been done by originally Don Meyer, and it is a great program to connect other siblings with other siblings. And what we have found in working in the community, that our faith-based partners, for example, may be able to provide both a SIB shop and a respite program, so the caregiver gets a full break and has that respite. And so because of time, I won't go into detail, but we do have to strive to support our siblings. They really do need that additional support. The data does show there's a high percent that may have an active role in decision making of their brother or sister with special health care needs. And as our caregivers age, they perhaps may go into primary caregiver role. So it is essential that we do better at supporting them at a very young age. And the data does show they have a higher likelihood of having that lovingly positive relationship with their brother or sister with special health care needs. Next slide.
So that's my contact information. If anyone, we can answer questions later, but that's it.
Thank you so much to both of you. That was an excellent presentation. I have questions, but I will hold them myself. Let's
Sure.
move on to our next speaker, Rachel with the South Carolina Respite Coalition. Go ahead.
Hello. Thank you all for having me today. I have some things prepared for you, and then I also have a lot of questions about what Oklahoma is doing. I think it's wonderful. So next slide, please. So we have a really similar mission for our voucher program, and the focus of it is, of course, caregiver relief. And so we award vouchers $500. They can get up to $1,500 in a year. So it's about $500 to $750, depending on what their plan is for using the respite. And they can be used to pay for in-home agencies, adult daycares, and private. And most of them are private individuals who provide the respite. And so we work with each approved family so that they can choose and select the best respite option for their situation and needs. Because of course we realize that families are the experts on their own needs. And so we want them to be able to make those choices. And so they can only be used for breaks from hands-on caregiving, and then they can't be used for those things listed below. So we also make sure that we assess, like, what other programs and benefits they're already receiving. Next slide, please. So this is our process chart for how we do our voucher program. And usually we ask that families call us for information about it before they do the application. And that provides us with a little opportunity to do coaching with them about respite and formal and informal systems of support and respite opportunities, and see if they might even be eligible, because our application is 4 pages long and includes a medical attestation of need. So we don't want family caregivers who are already stressed, who already have a lot of other task demands, to do an application that is going to yield them being ineligible. And so that also gives us an opportunity to be information and referral agents for them, and point them in the right directions for the care that they need. And we often do get applications from other professionals that we've worked with who know our eligibility pretty well, so that we can make sure we're getting appropriate referrals. We also work closely with Family Connection of South Carolina and get a lot of referrals from them, and they also help them fill out their clients fill out applications. I also go through sort of what our reimbursement process is as well, which is less interesting. So next slide, please. So process details. We also focus on care receivers age 59 and under. And that's because if they're 60 or over, they are referred back to the ADRCs, because we also receive funding sources, of course, from ACL, but we also have state recurring funding, and we partner really closely with the area agencies on aging so that they can administer the Alzheimer's funding and then also the state funding. And so we fill the gaps in service for younger caregivers and parents of children with disabilities. And as I mentioned, our application is 4 pages, and it includes a medical attestation of need, and then our caregiver survey is embedded in that. Currently, it's processed on a first come, first issued basis until the funding is exhausted, and we're looking at additional ways we might change that going forward. Our vouchers are valid for 3 months, and it's really such a difficult process for it to be extended. Family caregivers just need to call us and say why they haven't been able to use it and why they need to extend it. And so we could extend it further, and then that also gives us the opportunity to do coaching with them about how they can use it, how to find providers. And we recognize that one of the difficulties with families finding or being able to access respite with their respite vouchers is ability to find providers. So as I mentioned, they can receive 2 annually as funds are available, and then they submit timesheets to us monthly if they choose a private provider. And that allows us to see the rate of pay, the hours, have it signed by the caregiver and the care provider. And it also lets us know what the family used their respite for. So we get some really rich information that way about how families are utilizing respite. And then if a family has used it for with an agency provider, that agency bills us directly. Next slide, please. So we started our voucher program in 2011, initially through lifespan funding to build service delivery capacity and access. And we, as I mentioned, do a great deal of coordination with the other 10 AAAs in South Carolina. And we work really closely with the Department on Aging so that there's no wrong door in South Carolina. So we have a really, we attend their meetings and they know to refer to us in certain situations. And that way we can make sure that families are served across the lifespan. And the family caregiver support programs at the ADRCs also serve grandparents of grandchildren, not through respite vouchers exclusively, but with other programming. And so we currently have 3 funding sources. It's the lifespan funding, the state recurring budget line item, and then we do get voucher donations where people really, agencies and donors really want to provide that direct respite opportunity for families. Next slide, please. So our units of service and demographics are in 2019, we provided over 33,000 hours of respite through our voucher program. And South Carolina has 46 counties and we provided vouchers in 38 of them. The 8 that were not served are rural counties, primarily in a historically underserved area of our state. So we are targeting those counties now and trying to build more capacity for respite in those counties. Our average caregiver age was 47 and the range was 22 to 87, and average care recipient age was 20, ages ranging actually less than 1 to age 82. And then we made 668 reimbursements and served 346 caregivers. Next slide, please. So on those, when I sign those checks every month, it gives me a wonderful opportunity to see what it means to families. And so, of course, we all know that families use them for just what we consider just routine activities of their life. But my favorite is just about every month I see one for the last several months from a woman who says, I just sat quietly and breathed. And I also love it when people get to just use it for taking a nap. So it's not always going on cruises and going on vacations. It's often used for social time and building those socials of supports back up. Next slide, please. So every year we publish the Faces of Respite, and this is a family who received a respite voucher in 2019, and you know, they're just one of our champions. So I wanted to share their story and give you a few seconds to read through it. Next slide, please. And those are all the families that were featured in our 2020 Faces of Respite publication. And then also, this is from Shirley about her sister, Patricia. And that's why I'm so interested in the sibling program, and we'd like to ask more about that later. Next slide, please. We also use a portion of our voucher funding to partner with camps for people with disabilities around our state so that their caregivers can have respite for often a whole week while their care receiver is at camp. And so this is a letter from one of the care receivers who was able to attend camp. And we always want to make sure that families understand it's not for your loved one to go to camp, it's for you to have respite while they're away. And families really seem to appreciate this because it's a very cost-effective way for them to have a longer respite opportunity. And it's also really great for the care receiver to be able to have those social opportunities. So next slide, please. And so we identified some of the gaps in our own services. And so we're working with the South Carolina Rural Health Outcomes Committee, and we work with the South Carolina Partnership of Disability Organizations and Family Connection of South Carolina to make sure that we're able to reach some of these harder to reach communities, and so that we can expand our outreach specifically in those areas to make sure that this is an access opportunity truly for a whole state, which is largely impoverished and rural. Next slide, please. And so some of the challenges and successes that we have had with our voucher program is there's a lot of coaching that we need to do with caregivers and professionals about what respite is. And so it ties back into our larger work. And then we also have to be aware of the realities and needs of our applicants. Many of them don't have access to other resources or are very resourced. So we have to make sure that we're able to tie them in with their other needs and to help them make sure that they're getting those met as well. Many of them have additional service requests beyond just the respite voucher. And so we have to think about what those needs are and how that impacts their ability to provide care or access respite. And then we also have to educate other referral agents on eligibility so that they really understand the intent and purpose of our program. And then what we often find is the need for respite exceeds the availability of it, both through providers and through the families who are able to access our funds. Next slide. And so this is my contact information. Feel free to reach out to me if you ever have any questions. You can also reach out to Joe, who's on this presentation with us today, and then Allison Poole is our voucher coordinator, and she is amazing and really cares about our families in this program. So feel free to reach out to any of us here. We'd be happy to help you. And thank you.
Thank you so much, Rachel. That was great, very detailed. Now I will open it up to all of you. If you would like to ask a question of our presenters or of our voucher collaborative leaders. Nadine, I don't know, have you joined us? I guess not. Catherine's our only collaborative leader on the call today, but feel free to ask questions of our presenters, of Catherine, or of each other.
This is Jutta in Arizona.
Yes.
And one of my questions is, how are you handling questions of liability or fingerprinting, or does this come up at all in programs where you can use a friend or neighbor or family member? Arizona has had some real issues recently of some cases of abuse, and so everybody is really sensitive to that right now.
Anybody want to tackle that?
Are you referring to abuse of the voucher program or abuse of the care receiver?
No, yeah, it's abuse of the care receiver. And so I'm hearing, as I talk to other organizations, I'm trying to grow, you know, what we call our Friends and Neighbor program, which is a voucher program.
Sure.
And more people are saying, I'm not going to let anybody into my home, you know.
We just allow the caregiver to make that choice, and so I've not experienced that. Have you, Rachel?
No, and we're also really clear with families on screenings that they might want to do of people that they hire. And part of the coaching that we do with them is teaching them that when they hire a respite care provider, they're becoming a family employer. And so helping them think through what that means for them, and how to make that sort of change in relationships to one of an employer for a service for your loved one, versus just your friend from down the street. And I also see another question coming up for explain the attestation of need, what this means, and see, I don't have the full chat up. So who can provide it? Is it difficult to get? So we've made that really as easy as possible, because we don't want that to be a barrier to families to be able to access the service. But we also sort of need that to make sure that the service is going to those who need it. And so the attestation of need is just about it's the last page of the voucher application, and it can be filled out by case managers. It can be filled out by social workers, nurses, physical therapists, or doctors. So, a lot of them can use people that they regularly come into contact with to fill out that form. Does that answer your question?
To get back to the liability issue, I did want to point out that Catherine from Colorado and Jill from Washington have provided some responses to that. I know that in Washington State, they only allow family caregivers to use vetted provider agencies with their vouchers, so that those programs are known and licensed and I'm sure background checked. And also, Catherine says the Colorado Respite Coalition uses fingerprinting for all partner providers. It makes it tricky for providers wanting to participate, but unable to provide that information. But for us, it provides a sense of security for our caregivers and families, and we do not offer direct payment to the family caregiver or an individual they know. So there are some voucher programs that it's not a purely, it is consumer directed in that the family can choose, but they have to choose from a list of vetted providers rather than choosing any one of their, from within their own family or community network. And I don't know if Oklahoma and South Carolina have more specific tools that they use to help educate family caregivers when they are hiring their own providers. Rachel, you mentioned, making sure that family caregivers screen when they're hiring, and people may want to take a look at our ABCs of respite, our consumer guide. There is quite a bit of information in there on the questions that family caregivers should be asking, how to conduct an interview, how to follow up with references, everything they need to know about being responsibly finding a provider.
I think
that might be helpful to you, Yuta.
Yeah, thank you. That's really helpful.
I want to mention too on respite providers, we often find caregivers that are just super apprehensive to leave their child or adult with anyone. And so you have to coach them to use it. And so we just have not experienced that. We do have some respite providers that are licensed, care adult day centers, licensed camps, things like that. But we just have not experienced any abuse of a care receiver.
Jill, can I ask a question?
Yeah,
hi, it's Leanne from Massachusetts. I have a question because thank you for your presentations. I thoroughly enjoyed them, but you had mentioned that to be eligible for the vouchers, they cannot be receiving state-funded respite services. So how did you go about identifying those that fell within the cracks, I guess, those that were not eligible for state-funded respite services but needed respite? So what was your process for identifying them?
Well, when I do when we visit by phone and are just talking through the program, we talk about what other services they might be receiving. And just like Rachel, we provide a lot of resources. We have 19 counties in Oklahoma that are served by staff. So we are able to serve a lot of communities, and we just talk through that and make sure that our program is the gap. And many times it's not. Many times I refer them to Developmental Disability Services or to the SSI Disabled Children's Program. They may be a care receiver that's 60 and older, and we refer to your area agency on aging. So we kind of vet that. And also I work very closely on that respite coalition, and we visit on a regular basis, and every respite program in Oklahoma is involved in that. The area agencies on aging, VA, and of course lifespan, foster care, adoption subsidies, all of those things, we're all represented on that respite subcommittee. So we are fairly familiar with each other's programs.
And it's about,
go ahead.
And we go through the same things here, the same model, where we do a lot of referrals. We have a lot of conversations with other providers, state agencies, as well as with the families when they call. And then we also ask this on our application so that we can make sure families are routed appropriately. I see another question coming in. You have voucher amounts that differ. How did you come to the amount or limits? And how did you determine the voucher period of 3 months? Robin, do you want to answer that first, or?
Sure. That was already determined in 2010 when we first started managing this program through the Lifespan program. They had already determined the $300 every 90 days, and we have not varied from that. We've just continued with that. And if we have any write-in information on our comments from caregivers on the post voucher, it's they wish we offered more money, but that's been the established amount in Oklahoma since 2010.
And I'm not sure how that decision was made here, but I do know that $500 is a nice even amount of money. We also encourage families, if they choose a private provider, to pay about $10 an hour, so that evens out to them being able to get about 50 hours of respite. So, I think was just probably a logical number for us, just for managing the program internally. And families seem to be fine with it and are able to use it, and it works out well for us. So, and we do go up to $1,500 in a year, depending on ability to use and need, as funding is available. But we really focus on families receiving first-time vouchers.
And this is Catherine from the Colorado Respite Coalition. We have a very similar, different amount. And so we just recently went to $1,000 per voucher instead of $500, because we were hoping families would be more motivated to use it. And we have a 4-month deadline, and we're constantly wondering whether or not to adjust the amount per voucher or the time allotted. And I'm sure all of you experience the same struggles. I think our biggest struggle right now is trying to figure out how to motivate families to use their voucher entirety and how to start using it quickly once they receive it. So we're constantly looking at whether those things should be changed, and who's finding success with different timelines and different amounts as well.
And I see Jill in Washington says they also have a $1,000 per voucher for 90 days once a year. Is that correct? There was another question from Utah in Arizona. She wants to know if families can choose what to pay. Do they have to pay at least state minimum wage? Can either of you speak to that? I know that in some states it's completely flexible, but they can't usually, in some states they can't go over a certain amount in order to maximize the amount of hours that they receive.
Jill,
any of
I'm
you
sorry,
tie it
can
to minimum wage?
Jill, can you please repeat that?
Yes, she would like to know if families can choose what to pay. Do they have to
Yes.
pay at least state minimum wage?
Actually, go ahead, Robin.
No, we let the caregiver determine, and the majority of the time, as Rachel mentioned, our caregivers pay $10 an hour. And when I talk to caregivers on the phone and I'm giving them an example of how to use their voucher, because once they get the vouchers in the mail, a lot of times they have questions. And so we have amount charged per hour and number hours of care on our vouchers. And so they are just questioning how to complete that. And so I give them an example. And the $10 an hour, let's say you go out to dinner with your husband and you're gone for 5 hours, you charge $10 an hour. You pay the respite provider $10 an hour, that voucher will be worth $50. And so they tend to use that $10 an hour. I don't know if it's because I'm saying it or because it's easy for them to, a good clean number. And our vouchers are a 3-part carbon, where I get the white copy to pay from. The primary caregiver keeps the yellow copy and the respite provider gets the pink copy. And so that helps the respite provider and the caregiver keep track of what they're spending.
Yeah, this is Utah in Arizona. So we do ask people to pay at least state minimum wage, which has gone up to $12 here in Arizona. And I've been asking around a little bit in the disability community, and I've found some materials. I unfortunately can't cite it right now, but I found materials made by disability organizations that strongly speak about not underpaying people for respite, and that there really needs to be, attention paid to that. But nobody has been able to tell me what the legal requirements might be regarding this, because the family does become an employer if it's a friend, family, neighbor. So I guess, so we opted to be safe here, and we said you got to pay minimum wage.
You might want to check with your state Department of Labor, because they may have some strict definitions of employers in the state and what rules they have to meet.
Mm-hmm.
I mean, there are Department of Labor rules, and there are also IRS rules, tax rules, that have to be followed. Let me see, in Colorado, Catherine has let us know that they set their reimbursement rate. They will not provide reimbursement over $20 an hour, but they're starting to get some pushback on this cap because Denver's has such high living rates right now. Some opt for $20 an hour with the potential for the family incurring a small hourly copay. Anyone want to comment on that or respond to that? Cheryl is has raised some of the Department of Labor issues. She's asking, who is the employer of record for the respite worker if an individual is hired? What employer responsibilities are assumed by the agency coalition that's providing the funding?
We have a fiscal agent that sends a 1099 to the respite provider if they meet that threshold. But that's about as deep as we get into it, but we do track that.
Because your reimbursement goes to directly to the respite provider. It never goes to the family caregiver. Is that correct?
That's correct.
Right.
And ours only goes to the family caregiver, so we're not the employer of record.
Right. So the family caregiver there is the employer of record. Okay. Jill from Washington says also, like Colorado, Washington lets the provider set the rate, but also looks at the the complexity of care, and the state is looking at a cap. Anyone else have any comments or issues around employer of record or minimum wage or tax-related issues or guidance they'd like to share?
I was just going to say that, this is Rachel, that we let the family set the rate. We just set that sort of as a minimum that we recommend. Many families pay more than that, depending on the level of care that their care receiver needs. And so we leave that up to the family as well.
Any other questions or comments?
I have a question about the emergency respite that was mentioned earlier. I think that's a really wonderful idea to have a separate little fund or separate pocket for that. I get calls all the time of the caregiver needing surgery and, you know, it's coming up quickly. It was unexpected. And I think it would be wonderful to have that, but I also worry about what providers would be available to help that kind of need. And I know it might be different because you are able to pay, you know, family, friends, or other individuals. So I'm wondering if you have any kind of tips or tricks for expanding that gap for emergency providers as well.
That's a great question. We actually, in most cases, when we get those calls, the caregiver has an idea of who could provide the care. And but we do have some of our state programs that could possibly provide more, you know, like J.D. McCarty in Oklahoma, the 30-day respite. But for emergency situations, I don't know that it has come up where they can't find a provider. They're just in desperate need of additional resources because of the financial strain of going out of town, for example, to a funeral. So to my knowledge, that hasn't come up. We also try again to get our coalition partners to be well aware of the emergency vouchers as well as the educational vouchers, because what we also find is there's some great trainings, but then the caregiver is unable to attend. And so the educational voucher offers to pay while they can attend. So those two respite voucher programs, I think, have been very beneficial, even for those that are currently accessing a state respite program. I don't know if that helps clarify.
Yeah, it did. Thank you. I think it's just also a consistent gap of people, you know, needing that emergency respite and, like you said, finding more resources. So I think it's just going to be a constant battle.
It may vary by the age of the loved one, because what we have found too, our school paras are more than willing to provide care, and they have an established relationship. They have already been vetted through the school system. So depending on the age of the loved one needing care, we want to just really brainstorm with them some ideas that they may not be thinking of because of the additional stress level. So we do try to get them to think outside the box too, who is in their circle that they may not even consider until we say, hey, you know, what about so-and-so? They work with your child during the week, and they would say, I never even thought of her, or, you know, so we just really try to get them to decide. And again, it's up to them. We don't get into recommending, but we will brainstorm and strategize with them on other options.
I really like the idea of the paraprofessional. I'm a former SPED teacher, so that I don't know why I haven't really thought of that before, if we could incorporate that into our vetted provider field. So thank you.
Yes, thank you.
I'm sorry, this is Jill. Can whoever asked a question about emergency respite identify yourself? I didn't recognize your voice.
Yeah, sorry, it's Catherine from the Colorado Respite Voucher.
Sorry, Catherine. I did want to let you know that Maryland is using a large chunk of their lifespan respite funds for emergency respite. But they have recognized that so many providers, home health agencies and community-based organizations often can't provide the respite on short notice. So they have built into their emergency respite system a statewide contract with a home health agency, and they have agreement with that home health agency that they will provide an in-home provider on very short notice. So they built in the provider capacity piece into their emergency respite program so that a family won't be left, well, they'll have the funding to pay for respite, but no provider. That's one of the few states I know that's coupled their emergency voucher program with a link to a provider, an available provider. Any
Thanks.
other, I'm sorry, go ahead.
I was just saying thanks.
I see one question just came in from Cheryl, and I had questions about this as well. For Robin, regarding the community grants, who applies and what can they do with the $500 grants, especially since rural communities are benefiting? This is, I'm sure, of interest to a lot of folks. Can you elaborate on that program a little bit more?
Yes, we've had a variety in the 16 community grants to date. They were anywhere from 500 to 1,000, and we have used some. We've done it with some adult day centers, with some daycare centers, with churches. It's been a variety. There's a adult day, and they also have a workshop. It's called For Our Kids. They're in and they were one of the recipients, and so it's been a variety, and we've reached a variety of counties that we would not have ordinarily reached. And we ask that every community grant offer a respite, of course, event, and they specify the ages of the care receivers and caregivers that will be served, and what type of, they offer a program description, and then also a budget, so we know what they're budgeting the money for. So that's who we've used.
And some of the ideas, I see the question, what can they do? It's a minimum of a 3-hour respite event. And so when they're submitting the application, they do submit a program description, and they would have those details. And so it's been very interesting to see the various applications, and we're happy to share the application, Jill, if that helps.
That would be wonderful. I'd love to add that to our Lifespan Respite State Tools page.
Yes.
And we do have a whole page of voucher tools that states have been willing to share with us that you're all able to access.
Sure. They offer programming of all different kinds. Some of them have offered stations where the kiddos with special needs, siblings, whomever they're serving, can rotate through. They've offered outdoor activities, just a variety. We will not pay for a meal. So if they want a snack, that is something they can budget for, but we aren't offering meals. A couple of the ones at churches, they have offered a meal, but the church has furnished that, or it was donated by a community organization. A camp that serves grandchildren, only grandparents raising grandchildren can access this camp during one session in June, and we gave them a community grant for the grandparents to be able to transport their grandchildren every day for a week to that camp. And so just things like that.
It's a little bit like little mini grants.
Exactly. Yes, I call them mini grants.
Yeah, that's the terminology, or seed grants. And what we hope is we're going to increase their awareness, one, and two, we hope they're going to continue, and as they see the need, they would continue respite in their community.
We have received a request for a new grant from an EFMP at Fort Sill in Lawton. They're wanting to do a respite event and also include a program for parents. So respite will be at their child care center and in their area where all the kids can go and play, and then they'll offer programming for parents in another part of the quarters that they're going to use, facility they're going to use there on base. So we, are eager to reach that population as well.
For those of you who are interested in mini grants that Lifespan Respite grantees have awarded, you can find that on the Arch Lifespan Respite Tools page as well. I mean, for those, especially those states that aren't doing vouchers at all, in lieu of vouchers, they do award mini grants to community and faith-based agencies to provide innovative ways of providing respite in the community. So you might want to explore some of the ways. I know New York has done that, Massachusetts has done that, a number of states. Oklahoma's done it more than once. So it's another interesting way to not only expand respite capacity, but bring more partners into your coalitions. Any other questions?
I have a question about how everyone is distributing their funds. I've heard a lot that you're doing first come, first serve, and that's how Colorado is doing it as well right now. But we have recently, our wait list has become astronomical, and so we're wondering if first come, first serve is still the best and most, well, it's the most equitable way, but if it's still the best way to distribute our funds. Like, we're looking at more than a year on our wait list.
Wow, that's amazing. I know so many states are having trouble spending their voucher dollars, so that's interesting to hear. I'd like to hear how many other folks have wait lists as well and how you're responding to them.
So we, this is Rachel. We don't currently have a wait list, but we're very close, and we're looking at what procedures we need to put in place so we can do that, because we're currently sort of at the end of our funding, and we're slightly overcommitting because, of course, not everyone will use it, but we need to come up with procedures for how to handle a wait list. And we're also considering, we haven't discussed this or implemented anything, but we're also looking at, if we were to do priority scoring, what would that look like? What are some of the other family caregiver support programs in South Carolina doing as far as priority scoring, so that we can sort of match that, but also have it implemented in a way that's fair and really reflective of community and individual needs. So right now it is first come, first serve, but we're looking at how to possibly change that in the future, and if we even should. So we're trying to make that also be a data-driven decision.
Does anyone else on the call want to respond to that question? It's an excellent question. If you're running a voucher program, do you assess priorities, or is it first come, first serve?
In Oklahoma, we do not have a wait list, and I think part of that is because we have so many really great partners to work with on respite in our state, but we do not have one.
Okay, well, it's something we should track over time. I mean, we certainly want to know to what extent we're meeting the need for respite. It's hard to fathom that with our tiny little grants we're meeting all of the need. So as we move forward with your grants, it's something we should check in on every once in a while and see how, if people are starting to see wait lists. That would be an interesting thing to track.
Well, and I think part of our, oh,
go ahead, sorry.
I was just going to say, I think part of our frustration with the wait list is it's, you know, it's good for future grant requests to show the need, but it's frustrating that we're having to wait so long to meet families' needs. And I think part of my personal frustration as being a new program coordinator is once we do have the money out, someone just mentioned their overcommitting funds because you know everyone won't use them. I think that's part of my biggest frustration right now is the money sitting out there, and it could be going to another family that would use it immediately. And I'm wondering if, alongside of how you're distributing, how you are motivating families to use their funds.
I believe at one point there were some states that were doing a type of caregiver assessment to determine how immediate the need was for services. But you know, that can be very subjective. So there's some risk in doing it that way as well. Cheryl says in Nevada, we do some priority scoring. We target rural, they target age range, but recognize compound complex care as well. They do take first come, first serve, but only take on so many during each month. When we went to a wait list, we used a priority rating to pull off first. Cheryl, maybe you could expand on that a little bit. Are you able to talk via your microphone or telephone and talk a little bit about what your priority scoring involves other than targeting rural or certain age groups, or is that it pretty much? Corey says in Nevada, for her particular community-based program, when they have a wait list, they target those by age and then diagnosis. And that's for the Helping Hands program in Nevada, not the coalition. Oh, poor Cheryl has background noise. She doesn't want to subject us to that. Okay, if you have questions about Cheryl's priority targeting and want to know more, it's Cheryl Donnell in Nevada. I'm sure she'd be happy to speak with you privately. Anybody else have any questions or want to elaborate on anything you've heard so far or share any particular challenges you're facing with your own voucher program right now?
Jill, I wanted to mention something on SIB shops.
Oh yeah, go ahead.
Program at the conference in Madison. Harriet will be there discussing Wisconsibs, and
yes, that's a wonderful program. Yeah.
Yes, they serve. We also have an adult sibling program, and the SIB shops. The SIB shops are more active than the adults, but Wisconsibs serve SIBs of all ages, and so they have a great model. They're their own 501c3, and so she is going to be presenting. And so if anyone's interested in more information, I'm happy to share what I have, but Harriet will be there discussing Wisconsibs.
Arch also has a wonderful national partner in the Sibling Leadership Network. It's a nationwide group of siblings who are caregivers. I mean, they're usually older siblings providing care for their adult siblings, but that's also, you can Google them, and they have a wonderful website and lots of information as well.
Yes, Oklahoma is one of the partner states with a Sibling Leadership Network.
Any other last comments or questions? Thoughts? Topics for the next Voucher Learning Collaborative call that you'd like us to focus on? Catherine, did we get to your original issue that you mentioned at the start of the call when you introduced yourself?
Yeah, I mean, like I said, I'm new, so I'm learning from every comment and question that's come up so far. It's been extremely helpful, and I'm just trying to figure out if any of my further questions are worth exploring in our last couple minutes, or if they're kind of worth saving. One's kind of a weird question, but we're currently not using any software to track our data or with use of our, billing and everything with the program. We're just using Excel, and we're looking at upgrading that, and I'm wondering if anyone is using anything they really love, or a little bit different of a question, but
I'll answer that, and then I'd love to hear from anyone else. So we were using Excel to track our vouchers, and then we were putting it in our accounting system, and then our state system had another system that we had to use. So we were really duplicating a lot of effort, but also it made it more difficult to pull data and information. So there is a database that was developed in one of the counties in South Carolina for one of the other AAAs, and the person who built that database has made databases for several of the other AAAs, and so we're in the process of having that redeveloped for us with our information. And so far, it's been a really easy process to upload everything. It can generate reports, and it's not a very expensive piece of software. If you're interested, I can send you the designer's information. But I'd like to hear what everyone else is using too, because that'd be really helpful for us. But it's a much easier way for us to see everything on a database.
Here in Oklahoma, at the University of Oklahoma Health Sciences Center, we use REDCap, just REDCAP. I believe it's readily available nationally, but we've been able to customize a database utilizing REDCap because it does have the protected health information, security, and that's very important when you're collecting PHI. But for those that want to know what we're doing, that's what we use.
Jennifer Abernathy, who was a past Voucher Learning Collaborative leader, did a presentation for us on her use of Salesforce software. And I think there are a couple of other states that are using Salesforce as well. So if you wanted to go back on the Voucher Learning Collaborative page, you can find Jennifer talking more about that software. Is there anyone else who uses Salesforce that might be able to talk about that? I know Jennifer was quite enamored of it. Okay, well, we can continue to explore that and share that information as well. Those are all really great questions. The last request I wanted to put out to all of you, those of you who have been doing voucher implementation for a while, if you're interested in also being a leader of the collaborative, we've lost several leaders in the last year, and we'd love to have some, at least one or two other folks who would like to participate in a leadership capacity. And it doesn't really involve a lot of time. We just meet maybe by phone 2 or 3 other times during the year to plan out what the quarterly call will be for the larger group. Or if an issue emerges, that you bring it to us and we figure out how we're going to explore that. The way that Nadine brought the idea of doing the voucher survey to us, and we use the collaborative to collect the information. So if you'd like to be a leader of the collaborative, we'd love to have you. So just let me know, or let Catherine or Nadine know, and we'll let you know when our next planning call is. Any other questions? We're getting very close to our 2:30, so if there are no other questions, I'll let you all go, and wish you all that you stay safe and healthy. If you're self-isolating and you want to reach out to all of us, if you get a little lonely, we can have another phone call or Zoom meeting at any time. But let us know how your programs are going. Let us know if you have issues you'd like us to cover. And we will plan on meeting in another 3 months or so for the Voucher Learning Collaborative. And also, if you have a topic for the Lifespan Respite Learning Symposium in Madison that you'd like us to cover, we'd also love to know about that as soon as possible, because we're planning that agenda right now. And we may have the Voucher Learning Collaborative, if they're interested, if our leaders are interested in doing a short presentation at the Learning Symposium, we'll be talking about that as well. So any thoughts anyone has on that, just let us know. And hopefully We will see you all in June in Madison. Thank you all for taking the afternoon. Thank you to our presenters today. It was really fantastic. We learned, every time I listen to all of you, I learned so much. So thank you for your willingness to share. And we'll talk soon. Thank you, everyone. Take care.
Thank you.
Thanks, Jill. Have a great afternoon.
Thank you, Rachel. Thank you, Robin.
All righty.
Bye-bye.
Bye. There you go. Ooh, I can see it.